Greetings and welcome to this prevention primer on health equity. My name is Nicole Augustine. I am the founder and CEO of Rise Consultants, and I'm so excited to talk with you today about a topic that is really of great importance to me, and I hope it is something that is of great importance to you. This primer is just a short look into why we should care about health equity. There are just a few major key ideas that we'll talk about. I'll first start with a discussion about why are we talking about health equity in prevention. And then I want to spend some time really defining some key terms that are often misunderstood. And then at the very end, I want to really talk about what is our call to action. What should we do beyond just learning this information? Because knowledge is nothing without action. That's where the true power, the true change occurs in the world, when we apply our knowledge towards action. So I hope you enjoy this primer. Why are we talking about health equity? Now, if you've been in prevention or public health or any sort of social services for a long time, you know we have our moments where we have our crazes, our fads, we love our buzzwords, our acronyms. And if you've been in the field for a long time, we used to talk about cultural competency. That was the wave, right? Well, it is important that we understand that having conversations about equity, whether it's called cultural competency or health disparities or whatever buzzword we're using, the conversation about equity is paramount to the work we do. And truly, if you really evaluate what it really means to be a competent professional, it's something that we should have been doing all along. And there's two major reasons for that. The first is that in our code of ethics, principle number 1 is based upon non-discrimination. And if you really understand what non-discrimination means, it is the foundation of the principle of equity. So if you really think about it, right, we have a professional duty to prioritize equity just from our code of ethics. And so for me, I always say, sure, we're talking about this, and let's be honest, a lot of this really got perpetuated and spotlighted by everything that happened in 2020 with COVID-19. COVID-19 put a spotlight on issues that have been plaguing our communities for decades, even centuries. And I say, 2020 was a very interesting year, but it brought to light some things and some conversations we should have been having a long time ago. And so just based upon reason number 1, we should be talking about equity. The second reason we should be talking about equity is because if you're in prevention and you're practicing sound planning, that means you're using a planning model. And one of our most commonly used planning models is the Strategic Prevention Framework. Now, this model is something many of you have seen a gazillion times. The reality is the thing that's overlooked often is what's in the middle: sustainability and cultural competence. Now, my side caveat here is we have really moved away from the word cultural competency in our field, mainly because competence assumes a level of arrival, a kind of like accomplishing of a goal. And when you really think about culture, you can't arrive at this place of, oh my God, I know all the culture I can ever know. That's not even possible, because our culture is living and breathing and ever changing. So we do need to do some work on updating our language. I always have to say that because I'm big on language. I still say, though, that the fact that cultural competence is embedded in our prevention planning model, that means equity is something we should be thinking about in assessment, in a capacity, in planning, in implementation, and in evaluation. We should always be thinking about, are we equitable in our practices? So just based upon these two reasons, we should have always been talking about health equity in prevention. I'm glad we're talking about it now. So let's think about some foundational terminology. I like to do this only because a lot of times I hear these words used sometimes in the wrong way, sometimes in the right way. So I want to take a little bit of time. The real purpose of this primer is to make sure we're on the same page on what these words mean. So the first is the disparity. And the really easy way to remember a disparity is this is a burden of disease that's completely preventable. Okay? A disparity is a burden of disease that is preventable. And the reason it's preventable is because that disease only occurs because of social or really, I would say socially constructed boundaries, things like race and income. Okay. Gender. Sure, gender is a biological boundary. However, I'm talking about the social application of that, of limiting access to services and that sort of thing based upon gender of a person. Not the biology, not the fact that it's, a biological woman. So for instance, I'll give an example, right? Women can get cervical cancer, right? That is a very clear biological thing. That is not a disparity, okay? Because that's linked to biology. It has to be a preventable difference in burden of disease that's just based upon how men and women are treated differently. Men, women, and plus, right? We live in a very diverse society. So really, when you think about disparities, you want to be thinking and considering these are preventable differences in the burden of disease that are socially constructed and no other reason. Whereas inequities have to deal with the unequal access to services, to education, to healthcare, to housing. And often what you find, it is by the inequities that disparities are created. Okay, I'll say that one more time. A lot of the times you will find that is through inequities that disparities are created. And that's really the best way to think of those two terms. The last terminology I want to talk about here and think about is really understanding the difference between equity and equality and why we don't say equality. Okay, there is a really, really awesome graphic that was made by the Robert Wood Johnson Foundation that I want to share with you now. And I think this particular graphic is the best I've ever seen. I like it better than the boxes and the fence one that you all are probably all very familiar with. And this one really, really, to me, graphically and visually shows why equity is better than equality. So let's take a look here at what equality means. Equality says, my community needs bikes. So I'm going to get everybody, I'm going to make one bike, and I'm going to give everybody the exact same bike. For our first person, this is obviously not even helpful and beneficial because our first person can't even use the bike. Our second person, the bike is too small for what's comfortable. Sure, it's being used, but it's not very comfortable. Wow, we got a win on the third person. And then the last person in this picture here is someone to which the bike is too big. So this is equality. It says everybody gets the exact same thing. We don't consider anything else but that. Everybody is equal. Whereas equity really begins to think about what are the unique characteristics of each community, each person. How do I modify the resource to accommodate that particular need? So even if you're thinking about resources, right? In the first one, we had one bike. In this one, we have 4 bikes. And so a lot of times I believe the reason people move away from equity, it requires us to be more resourceful and it requires us to provide more resources to truly customize the needs of our community. I would say this is what we're called to do. Whether we like it or not, this is a much better situation than this, is it not? Where out of your 4, you only have one person who is benefiting, that's 75% of your community that's missing out on the good that you're doing. And this is what happens when we just not even consider equity in our work in prevention. So I really, really love this graphic. I hope that it's helped you better understand the difference between those two and why it's so important. So, what is our call to action? What is our responsibility to act and why? And the reason I end here is because, like I said at the beginning, knowledge is wonderful. It's wonderful. We have such great knowledge. The truth is, knowledge is nothing without action. It has no power without true movement and true change. And so I want to leave you with sharing one more graphic with you that really, to me, the first time I saw this graphic, it really spoke to my spirit as to why we should be doing the work we're doing and how interconnected this is with so many other things. So this is a graphic that just simply says, our environments cultivate our communities, and our communities nurture our health. And what I want to do is really kind of dissect this graphic and to share with you what it really means in prevention when we create environmental change. And that, to me, is the core reason why we focus on equity. It is about environmental change. So let's take a look at the graphic here. I'm going to zoom in here and we're going to start with the tree here over on the left. Okay. And the graphic here up at the top is saying that when equities are high and community assets are low, that's when your health outcomes are the worst. And what you're seeing here is a tree here on the left that has fragmented systems, restricted power. There's very little investment in the community and the community members are disconnected. And as a result, this right here, the trunk of the tree, the reason it's occurring is because of these roots down here. You've got roots of adverse living, segregation, marketing for tobacco and alcohol, poverty, unemployment, just all these situations that really are toxic. So the tree is growing in soil that's toxic. And as a result, these are the things that happen in the community. And the fruit of the tree is basically not existent. And the tree is instead overrun by things like substance misuse, infant mortality, depression, heart disease. This is what happens in our communities where we're not fixing the soil. The tree on the right is talking about what happens when we prioritize improving the community assets. And what ends up happening is that the soil is already different. You have quality schools, clean environments, transportation resources, jobs, access to health care. And as a result, the trunk of the tree is full of great things that help the tree bear fruit. There's a sense of community, there's leadership, social support. And as a result, what ends up happening is even though these health issues are in existence, they're the same health issues that are over here in this tree. Okay, so I want to point that out. Being in a community that has assets does not mean that your community won't have obesity, it won't have substance issues. But what it does mean is that your community will still thrive. And that's really the point of this graphic, is understanding the true power of environmental change, which I believe is at the core of what it means to practice health equity in prevention. I hope that this has been a great primer for you in beginning to understand why it's so important that we talk about health equity. And I hope that this primer has begun to help you think about the ways in which your agency, your organization, even in your personal practice, can be practicing health equity. Thank you so much. Again, this is Nicole Augustine, and it is an absolute pleasure to provide this primer for you.